So yeah, we're here today to introduce everybody to the Nottingham and Nottinghamshire System and Analytics intelligence portal. So, bit of context. As those of you who came to this meeting about a year ago will know, as a unit we are 1 year old now. The Nottingham System Analytics and Intelligence Unit formed on the 26th of July 2021 and recently had our first birthday. And one of the things that we aimed to do right from the start was to form a central function that puts data, information, and intelligence at the heart of ICS decision making. And there's a number of different elements that are needed to do that effectively. So you need good, trusted data. You need good analysis and good analysts, but also neither of those is particularly useful if you haven't got a way to give people access to the information and intelligence that you're producing. And what we realised quite early on is that there were lots of things being produced, lots of good things being produced, but some of them were being sent via email to limited groups and potentially filling up people's inboxes with big Excel dashboards. Some things were being saved on shared folders on the CCG's shared drive where a couple of people can access it, but not the even wider CCG colleagues, let alone the whole system. So what we realized is that we needed a solution to ensure that all system partners could access the analytical outputs that we were producing. So this is how the portal originated. Now, in parallel to all of this, we were also looking for a way to automate some of the dashboards a bit more than we had previously, to move away from Excel-based dashboards to something more data warehouse linked and feeding data through to more automated self-service type dashboards. So while all of this was happening nationally, the NHS had recently procured Microsoft M365, and there was some fairly superficial stuff, I suppose, going on within our system in terms of using Teams mainly. That's what everybody uses it for. M365 is Teams, isn't it? But no, it's not. There's a lot more functionality that comes with it that we've been exploiting, I suppose, through the portal. We thought we want a solution that doesn't require a lot of technical training in order to upload documents and to access documents and to find what you need. We want something that ideally isn't going to cost a lot of money, and we want something that all system partners can access. So the first thing that we tried, because everybody was familiar with it, was Teams. But we quickly realised that there were lots of different versions of Teams, and trying to give access to colleagues at certain acute trusts or local authority colleagues doesn't work, because they can access Teams, but they can't access documents on Teams, not easily anyway. So we realised we'd need something else. So what we've got effectively is it's a SharePoint based Microsoft M365 portal where we upload analytical products, analytical outputs, and give access to anybody in the ICS who wants access and applies to get access. So at the moment, the portal, I should say, launched on the American Independence Day on 4th of July 2021, and as at today, there's 11 Power BI dashboards on the portal. Again, using a Microsoft portal for a Microsoft dashboard product, which is what we're using, makes sense. They're fully compatible with each other. There's currently 373 users of the portal who have joined since the 4th of July, representing organisations across the ICS, both ICB, both local authorities, all three of our NHS providers, and our not-for-profit community provider as well. We've got certain people within the unit have got admin rights to upload and to edit things within the portal. In the last month, 188 unique users have accessed one or more of the areas on the portal, including 3,500 portal visits in the last 30 days. So I'm just going to give a quick overview of what's in the portal before handing over to Ryan to actually put the portal live on screen and just go into a bit more detail as to what's on some of the different areas of it. So things we're using it for. So it's a central system hub for our system information dashboards, which cover, as things currently stand, urgent emergency care, planned care, care homes and home care, demand capacity, health inequalities, serious incidents, discharges, something that we're calling resource, which is a lot of sort of facts and figures about populations within PCNs and practices within the ICS. Finally, patient experience.
Jack, can I just ask you to go just into present mode, just to make your slides just a touch bigger? Sorry.
That never seems to go to plan, but I'll give it a go and hope it works.
Okay.
Has that worked?
That's worked for me. Okay. Yeah,
Yeah,
it's just a touch bigger. That's great.
Yeah, no problem. So in addition to those dashboards, we're currently developing some reports that sit alongside the dashboards, we're calling intelligence reports. There's also information and guidance on there. So we've developed a number of guides as to how you use the dashboards, how you use the portal. News and events, if we've got webinars or meetings or other things that will be relevant to people in the system, our admin support will update that on the portal so that people are aware of what's upcoming. There's various documents that we've started loading on the portal now as well, agendas and meeting papers, for instance, so that instead of emailing those around to people, they're all there. And again, our team admin just send out the link to people, and it's all here on the portal. And finally, links to external resources, including training, which is an area that Ryan leads on. So within the sort of the dashboards bit, there's theme-specific pages. So if we take care homes and home care, the dashboard will be on there, but we can also link to the reports for care homes and home care and any information and guidance, news and events or documents that are relevant to care home and home care. There's four of the dashboards. I think Ryan may go into a couple of these in a bit more detail in a minute, but you've seen Power BI dashboards before. Here's four of the ones that have been developed so far. And at that point, I will pause. And Ryan, if you can, just pick some of the areas from the dashboard, just give people a flavour, please, of what we've got on there.
Yep, thanks, Jack. So I'll just take over the screen. So hopefully that's worked. It says presenting, so that's good. So you've seen the screenshots of the dashboard. What I wanted to do is a bit of a live demo this morning, just to go into some of the dashboards and some of the other areas, like the Analyst development program and some of the the Phm Deep Dive reports as well. So as Jack mentioned, SharePoint environment, so we can just send the link out to people. Just to make you aware, it's kind of by request to get access to the dashboard. So what we are saying is that anyone within the Nottingham and Nottinghamshire kind of health and social care space can request access to the portal. We will then kind of say, yeah, we're happy that person requires access. That access gets granted. They sign in once through kind of the Microsoft authentication process. And once they're in, that's it. It's kind of one click and you're into the portal. You can see I've got a link and I'll just go direct into the portal. So as Jack mentioned, we want to use some of this for kind of collating some of the big pieces of work that we do around population health management. which we call our Phm Deep Dives. As you can see at the moment, we have a number of those that we've done in the past 18 months or so. So if I just choose, say, the Aging Well one, then that will go and give you a PDF version of the Aging Well pack. I'm not going to go into the pack, it'll take too long, but what we can see, we've got 112 pages as part of the Phm Deep Dive, and it covers a whole host of different things, from kind of travel times to comorbidities to some kind of logistic regression analysis that we did. So, and kind of the population profiles around our aging well population. So I'm not going to go into the detail, but just to note, all of those deep dive packs have been collated in one place. So the next thing to note is the system information dashboards. So Jack went through the list that we've got. So again, I'm just going to choose the demand and capacity dashboard, and that will take you to the page that hosts everything related to demand and capacity. So we do have a few quick links. We do have the actual dashboard itself, which you can see has popped up on screen, but we can also save all of our insight reports in this area, and any other reports as well. And again, any kind of events or training around demand and capacity, we also can keep in this one place. And what it does mean is that if anyone across our Nottingham and Nottinghamshire area is interested in demand and capacity, then they will be able to go into this area and everything will be in one place. So I'm just going to put that into full screen mode. It was updated yesterday, which is good. So we've got a number of things. We'll look at kind of historical activity trends, which I'll show in a second. But as well as the activity trends, we look at year-on-year analysis. We've got things such as bed occupancy, both for acute beds and for community beds, and also our mental health beds. We also do activity against plan as part of our NHS England operational plan monitoring, and we also look at future demand as well. So we have got quite a bit of work on population projections. So people can go to the dashboard. Currently, we're on EMAS conveyances, which is shown at the moment. I was going to show you some of the options. So as I mentioned, we do look at making it across the systems. So we have our 3 acute providers, which is Bassett Law District General Hospital, Nottingham University Hospital and Sherwood Price Hospital. We also have our mental health and community providers, Notts Healthcare Trust and City Care, and we also have our ambulance provider in there. So we can choose any of the providers. We've got the different measures, be it activity, bed position or discharges, and then we'll have various measures for each one. So let's choose, say, COVID admissions, because it's a kind of a shape of curve that people will recognise. And again, you can look at that over the last 2 years, the different waves of COVID that we've had. Or if you wanted to, you can kind of zoom in to say the last 2 months, if you're just interested in the last 2 months. And again, you can do the kind of the year-on-year comparisons if you're more interested on what this year has done compared to last year. So again, that's just similar to again a Power BI dashboard. People will have seen Power BI dashboards before. I think the one thing I want to mention, as I've said, this kind of system data. We get the majority of our data direct from the trusts. So we use a lot of SITREP reporting. So everything that goes to NHS England, we look to get a copy of that to come locally. So we use a lot of SITREP reporting. Any kind of information flows that are based on total trust activity, we like to add. So we're not just looking at our registered population, we are working as that system view on total trust activity. And as I say, we also can do things like, if we're interested in future demand, anyone in the system can look at that. So if we're interested, say there's people in the Mansfield area and they're interested in looking at, say, the growth in over 65s over time, then you can, again, using Power BI, choose your over 65 population in the Mansfield area and start to look at that kind of population growth over time. And we've been using some of this information as well to start to do activity projections, which will help our kind of long-term planning. So that's one example of so that's the demand and capacity one. I'll quickly show you, let's just choose care homes. So again, a similar look and feel, same kind of homepage, similar kind of contents page, and again, we really wanted that kind of branding of our system. So again, you can look at, for example, maps of care homes. So we've got just over 8,000 residents currently, care home residents in our area. And again, you can, if you want to, you can filter that down to, say, mid Nottinghamshire, and it will go down into mid Nottinghamshire. We've also got some further information around our care home population. So again, you've got the population pyramids that show that kind of more females than male. And again, you can look at that by age group, and also look at things like ethnicity and comorbidities as well. So again, for our care home population, what types of comorbidities do they have? So again, lots of information within there. I could spend all day going through these dashboards, which I'm not going to. But again, just to note, there are a number of Power BI dashboards. We also have links to our another business intelligence tool that we use called eHealthscope, and that is the tool that kind of collects all of our clinical information from GP practices. So again, not for this session, but just to note, there is a link to all of the various areas within our other kind of BI tool that we host. Again, we've got all of the reports, which I think Jack's going to touch on in a second, so I won't go into the reports. We've got a number of presentations around what the SAIU is, our current progress against our S251 application, the structure and the membership of our team. And then we've got things like events. So anything that's analytical based, any training that we're putting on across the system, any upcoming meetings that are taking place. Again, any analyst across the system can come into this portal, and we'll keep this as up to date as possible, as well as any kind of news and updates, and also a few videos as well around training. So the last thing I just wanted to touch on was the Analyst Development Programme. So this is a piece of work where we're going to work kind of hand in hand with the Analyst X competency framework development to make sure that it's kind of aligned with the work that's happening nationally. So you'll notice, for example, one of the events is linking in with that competency framework. But what we want to do is create kind of links to national and regional training resources, and then look to create our own kind of Nottinghamshire and Nottingham-based training programme. So currently we've got a number of training resources such as the Analyst X Huddles, anything around on kind of the Futures website. We've got the information around making data counts. We've got the NHSR community, we've got the Phm community, and any of these links, you can just click on the link and it will take you to the relevant page. So be that the R community, the Phm community, information around, let's say, any kind of AFA training and events, and it just means that people can quickly find regional and local training resources either through the links, through the event schedule, or through some of these documentation, such as kind of making data count and some of the training that's been offered by the CSU. So I don't take up too much time. I'll pause there and hand over back to Jack.
That's right. Yeah, I'll go back to the presentation. So yes, so a lot of in addition to the portal, a lot of the efforts of the team so far have been focused on developing the dashboards so that people have access to data and to information. The bit that we now want to work on is making that that's elusive one version of the truth that everybody always mentions. But I suppose what we mean by that is something that people in the system recognise and messaging that people in the system recognise, so that we can ensure that our leaders are focused on making decisions based on data and information and intelligence, rather than understanding what version of the data is correct, because that's something that we should be doing in order to, and filtering that out so that yeah, our leaders can make the right decisions faced with the right information. So starting in September, we are going to be trialing a process for trying to do this as a system, which we can report back here if it's worked or not. But what we're trying to do is, around each of those dashboard areas that Ryan had up there on the portal, so care homes and home care, or development capacity, or planned care, we are going to take people through this process. So 5-step process. So the first step would be that the lead analyst for that area will produce an initial report pulling out that they'll have completed the analysis at that point, updated the dashboard, and be able to draw out some of what they think the key messages are. So there's three review steps. The first step is to play that data back to a group of analysts representing organisations within the system, to make sure that there's no disagreements with what the data is showing. There's no data quality issues that we need to be aware of, or changes in coding practices potentially that might show a trend that isn't real. That would then go to an internal review within the system analytics and intelligence unit to enable wider input and kind of cross-fertilisation of different things that people are seeing. So it might be that we've got the care homes dashboard is showing that there's been a recent increase in emergency admissions from care homes. So we want to cross-reference that against the urgent emergency care dashboard and make sure that that's showing the same kind of messages. Or it may be that we've done some health inequalities analysis within planned care, and just get that sort of expert input from our health inequalities principal analyst to make sure that that's using our sort of recognised methodology for looking at variation based on health inequalities. The final step is back to the system, and we're assembling what we're calling expert panels of clinicians and sort of operational leads to look mainly at the sort of high level conclusions and recommendations that the analysts are coming up with, to make sure that we're not saying anything ridiculous or outlandish that might fall badly if it goes to a board without that expert sign off first. And then the final step would be that we've got this sort of system produced report then that we'll have an analyst holding the pen or typing the keys, might be more appropriate in this context, but that's recognised and owned by the system, to then give that insight to hopefully drive the action and allow the board to make the right decision. So yeah, again, that's something we're about to start, and hope that will start to get closer to a sort of a one version of the truth type approach, and certainly some trusted outputs that drive the right action. Final thing to sort of tell you about is, as part of the our processes of using the N365 platform again, one of the things that we've implemented also is a data request process. So this is a functionality that exists within M365. You have to enable Power Automate, Power Apps, and Power BI in order to do it, and Microsoft Forms, I should say. But what it's meant is that we've now got a single log of all the requests that are coming in to analysts from across the system, so that we can understand the types of requests that are coming in. We can ensure that the right people are linked into each of those requests, and that the right resource is available if a request comes in, that we can easily screen at the start and say that that's not just a request for how many patients are in care homes, but it's a potentially quite a big project that's come in. Have we first of all made sure that we've got the right level of SRO buy-in and sign off that is something that we should be doing, but then also have we got the right analyst resource that we can align to that emerging project. So that's allowed us and there's still more to do around this, and making sure that the next step will be to make sure that we can attach or get links to allow analysts to attach their outputs to this log, so we can see what's being produced. And again, maybe some of that we might want to publish on the portal again. So it's again, this then links into that SharePoint environment that Ryan described earlier, and allows more data and more information and more intelligence to be shared with system partners that otherwise might just have been a sort of a bilateral conversation between an analyst and a commissioning manager, say, that has relevance for the wider system. And again, having the visibility, having the functionality to share, will enable more people to see some potentially important messages and things that require different levels of action or decision making within the system. So I think that is everything that we wanted to share today, but clearly that allows a bit of time for questions if there are any.
Yeah, no, thanks, Jack and Ryan. It's really impressive to see the sort of breadth of content that's sort of on there, and yeah, great to see you're not just seeing it as a sort of series of dashboards, and you're thinking about that sort of insight to action approach in terms of how you get some of the analytical findings sort of fully utilised and acted upon within your system. And I think, just judging from the comments and questions on the Mentimeter, yeah, quite a few people are quite interested in terms of how they might replicate some of what you've done. So it's great that you've managed to progress it and take it so far. I'll just share my screen just so you can see the questions. There's a nice sort of mix, hopefully, there. So maybe we'll just sort of kick off. There's a couple talking about the how it sort of integrates with your PHM linked data, and what sort of data sets the actual sort of portal's sitting on top of. So I just wondered, yeah, if you could maybe just answer those sort of initially.
Yeah, so with that one, I think we need to get the IG sorted first. That's all stuff that, well, it needs to happen underneath the bonnet before we can surface it. So absolutely, the ambition is that you would be able to for instance, I don't know, if we've got a segment that's in the GP record, we can flag people with frailty, link that to sus data and have a look at their emergency admissions for the last 3 years. Then that's kind of where we want to get to over time. But legally we can't do that at the moment. We've got because it's not for direct patient care purposes, using that primary care data. So we've got a section 251 application that's sitting with CAG at the moment, due for a decision in September, and if that's granted to us, then that starts to allow us to use some of that GP data for secondary use purposes and to surface some of it at an aggregate level within the dashboard. So that's certainly the ambition, but we're not there yet, not for technical reasons, but for IG reasons.
Okay, no, that's great. There's just a question there in terms of, the types of Power BI licenses that you have. So I presume you've got the sort of Power BI Pro licenses sort of locally.
Yeah, so Ryan, correct me if I get any of this wrong in terms of the specifics, but I think we've got what's called the enterprise agreement, I think, which is you effectively buy a load of sort of there's probably an upper limit, but it's effectively, for our purposes, unlimited access for an organisation. I think we've just done that for the ICB as an organisation, but then additional users can join the portal and we can give access to them from wherever. There's additional pro licenses, I think it is, that the analysts have as developer licenses to allow them to create dashboards and to publish dashboards. And the third sort of choice you have is whether you go cloud-based or whether you go on premises and host it on one of your own servers. And we've gone with the cloud-based option. Again, it allows sort of unlimited storage. Effectively, it's not unlimited, but for our purposes, we wouldn't need to expand our capacity in terms of server space. So yeah, cloud-based enterprise version with additional developer licenses. I think I've got that right, am I right?
I saw some nods from Ryan.
Yeah. So in essence, yeah, we've got kind of the premium license, but then we have a number of pro licenses. So yeah, as Jack says, our analysts can do some development and actually create the dashboards and share the dashboards to help us kind of in training and development of those dashboards before we publish them to the portal.
And I presume that's sort of facilitated by conversations with your sort of IT and digital colleagues locally to sort of work through that.
Yeah, so we needed a lot of support from our health informatics service to help with this.
Yeah, okay, that's great. There's a nice question here around sort of reflection that it's really great. But is it being mainly used by just the ICB, or is it really being adopted properly by sort of other partners within the system? I guess that's why I know you've got them sort of on board, haven't you, in terms of access, but are they sort of actively using it, I guess, at the moment?
Yeah, so I suppose the two case three, I suppose, two of them go hand in hand. So in a second, I'll let Ryan talk about how it's being used for discharge analysis and demand and capacity planning. But the case study that I'll quickly give is that we've recently had conversations with our two directors of public health for the city and county, and the idea is that we're going to use the platform to help with some of the JSNA work that's going on at the moment. There's some analysis that we can pull out from our health inequalities dashboard. One of the other dashboards, I think it's the resources one, which has some of the sort of PCN level population data, and the idea is to use the platform to pull bits from those dashboards and create a starting point for the JSNA that can then be enhanced with public health insights. So that's very much going to be a joint system project with our two councils and public health teams within those councils. So yeah, I mean, I think most of the users probably are ICB colleagues, but we certainly want to expand the sort of non-ICB user base, and examples like that where we can sort of galvanize individuals around a particular piece of work, I think, are really useful for doing that. Ryan, do you want to add something for the two other areas I spoke about?
Yeah, so kind of on the discharges dashboard, that is very much a system view, because as we know, around kind of delays in discharge, it's not just people being delayed in hospital. There's delays all the way through that kind of discharge pathway, be that kind of interim beds for community or care homes or social care, or be that kind of home care within people's own home. So what we wanted to do was create a dashboard that actually looked at that full discharge pathway. So we collect data from the acute trusts, from the community providers, and from both of our local authorities, Nottingham City and Nottinghamshire County, to create kind of a view of the different steps. So where there's kind of delays and bottlenecks across that discharge pathway. The ambition in the end, it will be to link those up through NHS number, but as Jack mentioned, we're not quite there yet. But what we have got is lots of information along the pathway, so all of the system can kind of see which areas are particularly struggling at certain periods of time. And then we link that into our kind of demand and capacity modelling. So again, we want to have a view of kind of total system position. So we have a system planning group that again has system partners from all of our health and social care organisations, and as part of that system planning, not just kind of acute bed planning, it's proper system planning. We wanted to create a dashboard that allowed lots of information from different organisations to go into that. So again, that's a good example of where we've got local authority kind of buy-in as well as NHS.
No, that's really great. And certainly the JSNA sort of example is an easy way of sort of tying in local authority colleagues, isn't it? There's a statutory requirement for local authorities to be producing those, and all public health teams and other colleagues will be involved in those. So yeah, it's a nice, neat and easy tie-in. There's quite a lot of questions on the Mentimeter around sort of, I guess, the capacity and resource that's been involved in terms of developing, but also maintaining the portal. I just wonder whether you could give colleagues a bit of a feel for the level of intensive work that's gone into this, and maybe how long it's sort of taken to progress.
Yeah, so work on this has probably been going on since about October last year in earnest, I'd say. And so at the start, I think it'd be fair to say that none of the analysts in the unit had used Power BI before. But we chose Power BI because everybody was familiar with Excel, and a lot of the sort of the ways that you use Power BI are quite similar, combined with SQL knowledge. So again, we had analysts who use SQL, were familiar with Excel, and quite keen to try something new. So we quickly got some sort of expert users, and Ryan taught himself how to use Power BI quite quickly, and one of the other principal analysts within the team as well. So we were kind of doing so almost iterative learning. So people in the team would try out things in Power BI. I think Ryan and Irene were hosting either weekly or fortnightly sessions with the team to demonstrate how to do certain things, to allow people to show bits that they'd done. At the start, we didn't have a prescriptive way to do the dashboards. It was kind of allowing the analysts to try out different features. The analysts would use YouTube, Google things in terms of how they wanted to do it. We've gone for an approach to try and use DAPs as much as possible, so that the dashboards are quite flexible and interactive, and you haven't got too much that's hard coded and then loaded into Power BI. So quite a lot of the calculations happen at that point in the process. And again, the analysts have learned all of that along the way. What we've now got in terms of the governance is there's a lead analyst, an owner of each dashboard, who's responsible for maintaining that dashboard and publishing the new dashboards. We've tried to implement the dashboards in a way whereby each analyst only has one or two dashboards that they're responsible for, so that nobody's overwhelmed with too many dashboards. And yeah, we've got the dashboards are kind of part of everybody's work as well. So what we haven't got is a BI function that does all the dashboard stuff, and then you've got analysts separately. If you're an analyst, then you're probably going to have a dashboard that you use to produce the data that's relevant for the group that dashboard services. We've got two administrators for the team generally, and again, part of their role is administering the request process. It's loading the events onto the portal, it's loading the deep dives onto the portal, etc. So it's just become part of their role. It's not anybody's dedicated role to do this. In terms of, we've got I think it's about 25 analysts across the team. So some of them will have dashboards, some of them won't yet. I saw a question about workforce, so that's an area where we haven't got particularly good data sets at the moment. We haven't got nice flat data files that you can load in and analyze in that way. It's something in the pipeline that we're working on at the moment. And then I suppose the other bit that's relevant is few questions about CSUs as well. So in Nottingham and Nottinghamshire, we've not historically had an outsourced function with a CSU for any of our data analytics work. We've got two, I think they're part-time people in our health informatics service who run our data warehouse for us and receive the commissioning data sets from the desk row. We've got an in-house data management team who process all of the GP data and also do the data linkage with some of the acute data sets for and other secondary care, mental health community data sets for direct patient care at the moment. But again, there's plans to expand that going forward once we've got the IG in place. But yeah, no, it's all within our team at the moment. The only additional support we've had for this is we've had a part-time program manager that we've hired on a temporary basis, and two part-time consultants as well who have been working with us, who have lots of experience using the N365 package, having been part of early pilots in other ICSs. So we've had a bit of external support, but it's largely been up to the analysts teaching themselves and teaching each other.
Yeah, no, that's great to hear, and it sounds like, yeah, it's almost sort of business as usual, I guess, in terms of the way the team, you know, sort of utilise the portal and get the information sort of uploaded and maintain it. So no, that's really positive.
Sorry, Gareth, just to add on that as well. So it has become kind of part of our day-to-day work anyway. So all of the old Excel-based versions we used to do, all of those discussions with provider organisations of which data was right and which data was wrong, a lot of that now has been replaced with this new process of let's agree what data is shared, let's present it on the portal, let's add that cross-validation within a cross-organisation working group. That now becomes our business as usual. So it just helps. It's not really additional work to what we were doing. It's kind of replaced the type of analysis we were doing.
Okay. We've got a few sort of other questions on there that maybe we're probably not going to quite have time to answer. I just wondered whether, you know, other systems are looking to sort of learn from you guys, I guess, in terms of how you've approached this and, you know, the work you've done. I just wondered whether, you know, what would be the sort of couple of bits of key advice to other systems looking to, you know, do something similar within their patch. Any sort of key bits of learning or any sort of thoughts on that aspect?
Yeah, I think one of the things that I'd say is make sure that people bring your sort of customers along in the journey with you. I think so. We've tried to do that, but we've probably not done it as much as we maybe should have done. So in a few areas we've had some resistance where people don't fully realise what the dashboards can do. Don't see how it improves on what they had previously and want to go back to what they had before. So I think if we've been a bit more proactive with some of that, then yeah, well, it could have set the scene and made things easier in some areas. Since a couple of areas there was a bit of unrest, and we've since sort of managed to reassure people that they'll have access to everything they had before plus more, which has been fine, but doing that a bit more up front would have perhaps been beneficial, and doing it with sort of more junior members of some of those teams. I think we had the discussions with some of the sort of directors and associate directors, but they hadn't necessarily cascaded what that meant down to their teams. So I think the engagement at the right level for people who are practically using the information is key early on. Ryan, have you got one as well?
I think from the dashboard development point of view would be try really early to decide, have an agreement across the team of the look and feel of the dashboard, create a template that everyone's happy to use. But it's not just the look and feel and the template, the actual the kind of the data model and the data structure that sits behind it. Again, get cross agreement from everyone how that will work, because when building the dashboard, that's obviously the front end. I think getting all of the back end analytics agreed and sorted nice and early really helps, and then your analyst can go away and linking with the stakeholders, find out what metrics they want to measure, and build dashboards that work for the customer base, but also work in the grand scheme of the look and feel of the portal.
Okay, no, that's great. Yeah, a couple of really sort of tangible bits of advice to other colleagues. It's just coming up to a couple of minutes to 12, so I just wanted to say a massive thanks to Ryan and Jack for giving up their time this morning and talking us through their portal, which is really impressive. And I'm sure lots of other people have got some really useful sort of thoughts now in terms of how they might progress similar type things sort of locally within their patches. There were a couple of comments just in terms of sharing slides. I presume we're sort of okay to do that, Jack, so we'll certainly put those on the Teams channel. Patrick, do you want to come in very quickly just with a quick question before we finish? I can see you've got your hand up.
Oh, hi, yes, sorry. I just wanted to ask in terms of, I think it's quite crucial with your project here. How did you get over the central tenant problem? So do you host your SharePoint on the NHS Net tenant, or can you enable access from Trust's local internet, local email user, the domain name? We're trying to do something similar, but that's our number one problem, is that we're not part of a federated tenant within our organization, and we don't know how we can enable a SharePoint to trusts that use their own domain email addresses.
I recognise the problem. I recognise the issue because we had that same issue.
Yeah.
I might have to check with our IT people, unless Ryan knows the answer, as to what solution we went with in the end. I think we've got a local tenant that we're hosting it on, but I'd have to double check that. We started off on NHS Net and published it through Teams, but of course not everybody could access that. So I think we've got. So working with Microsoft, I think we've got a local tenant now that hosts it, but I'd have to check the user accounts associated with, but I'd have to double check that and get back to you.
Thank you. I'll email you, because that's I absolutely love what you've done here. It's absolutely fantastic and really, really useful. But if we can get over that hurdle, then we can do something similar.
It took a while for us to do that.
No, we'll link you up, Patrick, and I'm sure
you.
Jack will be able to help and get you the answer to sort of help you progress things. Okay, thanks for that. I'll just move back to the Mentee board. So just a heads up really that coming in the next couple of huddles, we've got an overview of the PHM training programme from Health Economics Unit colleagues, and there's an upcoming analysis of some work that North West London have done around the ageing population. Those are coming up in the next couple of huddles. And then just a heads up as well that the new training and development prospectus is out on the MDSM website. So please do take a look at it. There's the System Dynamics training programme that Stacey mentioned at the last huddle. There's a couple more cohorts of the leadership development for analysts that's open for registration. Some new dates for the healthcare science and operational research training. Some more technical training around our GitHub and reproducible analytical pipelines, and a whole host of other stuff. So please do sort of check that out. But we're just past the midday mark, so just wanted to thank everyone for dialing in today, and a big thank you to Jack and Ryan again for sharing their experience of developing their portal in Nottingham and Nottinghamshire. So thanks for all the thumbs up and questions and comments, and we'll see you